Welcome, everybody. People are joining us now, it looks like, which is wonderful. Welcome, welcome. Happy Heart Valve Awareness Day. So while we're everybody's joining, I'll just tell you, we're in a webinar mode, which has some great opportunities for having panelists and panelists able to share and polling our attendees and all of that. But it has a little drawback in that it doesn't allow us to see the attendees' faces. I'm sorry about that. But I want everybody to just take a look at the bottom of your screen. You might have to roll your cursor over it if you're on a computer. And you'll see some options for chat and for Q&A and for polls. And I'm going to actually just practice this and launch a poll right now and see if you guys can see it. Does everybody see? Does your valve have a name? For example, Bessie or Porky? And then please choose an answer, of course, or no, do people really do that? Or wow, I never thought of it. And you should be able to see that it's showing on your screen the percentages of people who are responding to that poll. And I believe our panelists have named their valves, and so we'll hear about that too. If you have questions that you would like to direct to any of the panelists, to me, in general, what have you, you can type it in where it says Q&A, and you can type in your question, and we'll be monitoring the questions, and we'll either respond in writing or verbally with the webinar. So it looks like 17% of us have said, of course. Oh, and panelists, you can vote too on the question if you'd like. And most people were like, wow, I never thought of it. So you'll hear about naming your valve today, and you'll get an idea of, maybe you'll want to do that too. Okay. So welcome again, welcome. It's a happy Tuesday with the two, 2222, gosh. So we're glad you're here, and we would like to, oh, you know what, I'm gonna just skip on, tell you really quick about Heart Valve Voice US. And we are a patient-led organization that we focus on diagnosis, treatment, and management of heart valve disease. We advocate for detection and support and access to appropriate treatment. We also have a My Valve, My Voice patient care partner community. And in a minute, I'll type in a poll and ask how many of you are participating in the community, and if you knew that we had an app that you can use on your phone. And actually, here's a little picture of what the app looks like. And you just search for My Valve, My Voice in your app store, and you can check it out. And that's what it looks like in the Google or the Apple App Store. I'm going to stop sharing my screen so I can see everybody. And let's take a minute to introduce all of our panelists. Oh, I've got to join in. Everybody looks so good in our glasses. Lisa, I'm so sorry you don't have any hard glasses.
I'm with you in spirit, if not in shades.
Thank you. It's hard to, it's hard to see with them. we'll probably all take them off at some point. John is our executive director. Would you like to say hello to everybody?
Well, hello and welcome to our webinar. I think Susan's put a great program together. We're thankful for the guests we have. And I really can't see much at all wearing these glasses. So I will be switching out shortly. But thank you all for joining us. And we really look forward to using this format. Also, it's the first time we've done this Zoom webinar format with polling and all of the features. So hope you enjoy it. And started.
Okay. And we are actually going to start with Lisa. Well, let's introduce everybody really quickly, and then we'll start with Lisa giving a presentation about caregiving and care partnering. Lisa's from the Caregiver Action Network. And then we have John and Kathy Sapp, who John is a patient and Kathy is his wife and care partner. And Deborah North is a patient, and we'll be hearing more about their stories and experiences later, but we're going to start with Lisa. So whenever you're ready to share your screen, Lisa, feel free.
Great. Well, thank you, Susan. And it's so wonderful to talk with all of you and to meet my fellow panelists. I am Lisa Winstall, and I'm the Chief Operating Officer for Caregiver Action Network. And at Caregiver Action Network, we support family caregivers across the lifespan and across all disease states and aging continuum. So what that means is that we are there for people who are caring for a child who was born with a life-limiting condition, a husband who's caring for his wife with MS, who was diagnosed shortly after they were married. We're there to support the family caregivers of our wounded veterans, which are sometimes their spouses and sometimes their parents. And we're also there for all of the adult children helping an aging parent or a loved one or a spouse with Alzheimer's. We have resources for cancer caregivers, and the list goes on. But that also means that we're there for all of you who are caring for a loved one who has heart conditions of any number of varieties, heart failure, and of course, heart valve. So we are the Caregiver Action Network as opposed to the Care Partner Action Network. And so I'm going to explain why. The Care Partners right now are sitting here on the screen, embodied definitely by John and Kathy Sapp. And Kathy is there, I am sure, fully, and we're going to hear from her about how she partners with John in all of their decisions, in all of their care choices, in their entire care journey. But who is it that makes sure John gets his medications and manages that and takes care of all of the paperwork and makes sure John gets to all of the medical appointments and interfaces with the doctors? And I'm kind of thinking that's Kathy, right? And that's not because John is incapable, it's because John's sometimes a patient. I'm going to tell you something else. Sometimes Kathy needs to be cared for too, because caregivers are also sometimes patients, but family caregivers experience extreme amounts of stress and depression. And in fact, and I'm not singling you out, Kathy, you just happen to be a great example, spouses caring for another spouse are 3 times more likely to suffer clinical depression than non-caregivers. But if it's the wife caring for the husband, that number goes up to 6 times more likely to suffer from clinical depression than a non-family caregiver. So while we partner with our loved ones in care, we have to remember that that partnership flows both ways. So John, today at this webinar, I'm going to call on you and all of the other patients who are joining the webinar to always think about their care partner. Make sure that they're taking care of themselves as well. Okay? We all have so much on our plates. Okay? When you're a family caregiver or a care partner, you're spending so much time going to the doctor and managing the care for that patient. Guess what? You are going to forget to take care of yourself. Now, I can speak to this because I personally put off my mammogram for years while I was a family caregiver, because I just didn't want to take off another day from work. I didn't want to walk into another doctor's office. I just didn't want to deal with the whole rigmarole. We cannot do that to ourselves. Okay? So whether it's getting your annual exam or a flu shot or a walk in the park to clear your head, family caregivers have to take care of themselves. So John and all of the other patients there, Deborah, make sure that the person who is caring with you is also cared for. Now, thank you, John. As promised, a few words about the distinction between the terms care partner and caregiver. Care partner, we find, is a term frequently in situations where there tends to be a one-to-one relationship. Okay? So John is primarily cared for by Kathy. And all of you who are listening who are patients, or all of you who are listening who are providing care, have a one-to-one relationship. That's a care partner, because at Caregiver Action Network, we really stress that we want the caregiver and the patient to be integrally involved in shared decision-making. I'm going to go on about that in a minute, but it truly is a partnership. So why do we say caregiver instead of care partner in our name? It's because in many instances, it is not a one-to-one relationship. In so many conditions, there are multiple people who are involved. So when, let's say you're the adult child caring for a mom with Alzheimer's, to say that you are her care partner, we have learned tends to exclude others from their role in the care team. So I want you all as care partners and caregivers to think for a moment about the ability to involve more people in that care team, whether to support the patient or to support the care partner. Think about those people who are in your faith community, who are in your neighborhood, other members of the family, your children, your adult children, your siblings, your parents. Build that whole entire care team so that everybody can be a caregiver and that nobody feels excluded from supporting either the care partner or the patient. So with that, I'm going to talk a little bit more about Caregiver Action Network, and hope you'll forgive me for our nomenclature being different from the words that you're all used to, and hopefully you understand that now. First thing I will tell you is that at Caregiver Action Network, we don't teach you a thing about medical conditions, but we do have resources for people in different areas. We've got lots of videos for Alzheimer's caregivers. We're not there to teach you about Alzheimer's. There's the Alzheimer's Association and the Alzheimer's Foundation for that. But what we have learned is that those caregivers have different pain points that are specific to the disease of their loved one. Because while about 80% of all caregiving is the same, the 20% that's different, that 20% that's because you're talking to somebody who has had a heart valve replacement, that 20% is what makes your caring different and more difficult. So what we try to do is build out resources that are specific to those conditions. So one of those resources that I'm going to first talk to you about and first show you here is the closest thing that we have right now is our heart failure caregiver navigator. And in the heart failure caregiver navigator, one of the sections is preparing for those ER visits. They can happen. And the best way to keep them from causing stress and to hopefully have the best possible emergency experience, if there is such a thing, is to be prepared. So we have some tips here on our website at caregiveraction.org. Things about figuring out, is it time to go to the ER? First thing I have to tell you is that you all have to speak with your doctors, primary and specialist alike, and review a list with them. At what point do we need to go to the ER versus calling you first and waiting for a call back? We also talk about what to do if moving a person could cause further injury, which is not always immediately apparent. But my favorite tip, and here I'm talking to the care partners, is about preparing a go bag. Now, I'm sure some of you have had children, or if not, you remember all of the old TV shows where when the woman goes into labor, you have to grab the bag that's pre-packed by the door before you run out of the house. We all need our caregiver go bag. Nobody's having a baby, but you have to be prepared for heading out to the hospital at a moment's notice. So what goes in the go bag is, first of all, your patient file. A couple of hot words about your patient file. Sometimes that's still a binder with pieces of paper in it. We may never get away from that because some things, like especially imaging, has to be on paper. It can never be a flash drive. As I'm telling you right now, there isn't a hospital in the world who's going to plug a flash drive into their system, no matter how trustworthy you are. We are getting to the point where it might be something, an app on your phone. There are some health apps that are coming online now that are reputable and safe, where you can download from multiple doctors and specialists all of your information into one very safe location. Always be careful before you choose which kind of app you're going to use to store your health data, because you don't want to lose it or overshare it. So that's your patient file. I always throw a blanket, like even a little small throw, into the go bag. Either the caregiver or the patient might start to feel chilly. And the last thing you want to do is always be hitting that call button to get a nurse to get you a blanket, because they're busy, they'll resent you, and it will take a long time. A cell phone charger that is dedicated to your go bag. It's great if you have that extra battery pack in your purse or in your pocket, but if you don't always have one in your go bag, you're always going to be caught without it. I also like to include with that an extra long charging cable. Snacks are important. When I was a caregiver, I pretty much failed at this, but I've put it in the website for this reason. You're going to be at the ER. It's going to be the early hours of the morning, and the only food's going to be that disgusting stuff in the vending machine. And not only should we avoid it for our own heart health, it's just nasty. So put a few good quality snacks in your go bag. If you haven't had a trip to the ER in a while, make sure you remember to change them out so they don't get too stale. But some snacks, some bottled water, change of clothes, cards, books, maybe a book of Sudoku, whatever, just to keep you going, and make sure it's always ready. We have a couple of tips for that ER visit on the website, and a few other, fun things about what to know at discharge. But overall, in the Heart Failure Navigator, you'll find some really specific heart-related tips. Of course, on that journey, remember as a caregiver to always take a pit stop for yourself. Little tip that I came across, actually while caring for my mom when she had cancer, was take advantage of a moment if your loved one is in the hospital and not the doctor, not the nurse, but maybe the tech comes in to take vitals, to just do some routine care. That is your family caregiver, care partner break. Take that moment to leave the room. Go to the bathroom, walk up and down the hall, get yourself a cup of coffee, take a breath. Because while that's happening, your loved one is not alone. Nothing medical will happen. Nobody's in there to talk to you that you'll be missing out on information. But that's a really good chance for you to take care of yourself. Now, let's see if we can do this. Now I'm going to talk for a hot second about our Caregiver Help Desk. The Caregiver Action Network, the first thing you need to know is anything you come to us for at all will always be free. Okay? Family caregivers come to us for free resources and support. And that includes access to our Caregiver Help Desk. You can access the help desk by phone. You can see the number on your screen there. Or if you're on our website at the top, you can click to email, or you can even click to live chat in that little orange bubble at the bottom. Our experts there are exactly that, experts. This is not some call center where they're going to take a message for us. This is our staff that's out in Chicago, and they are trained to support the family caregiver. They'll connect you to resources. They'll listen. They're so good at listening to what it is that's going on in your life right now and help you with strategies, not just give you a phone number to call. So I would like to really encourage any and all of you to go ahead and reach out to the Caregiver Help Desk. at any time and always for free. Now, the next thing I want to share with you, I have to stop and start again, is our 10 tips for family caregivers. The first thing, you all already get a gold star because it's to seek support from other caregivers, and remember, you're not alone. So often care partners will say, I felt so isolated. I felt like nobody else understood what I was going through. By coming to this webinar, by connecting through the app, by listening to the stories you're about to hear, you will understand you're not alone. We've already talked about how strongly I feel about taking care of your own health. But here's another way to take care of yourself. Accept offers of help from other people. Wow, that's such a hard one. If somebody says, what can I do? Have an answer ready. Don't say, I'll call you. I'll let you know. Say, you know what? It would be really great if you could shovel the walk the next time it snows. Learning how to communicate effectively with doctors, well, there can be some road bumps there. We have some resources on our website for that, on active listening and talking with healthcare providers. We do encourage caregivers to take breaks often, but a respite break doesn't have to be a weekend at the spa. It can be those little walks up and down the hallway at the hospital. Want to take this time to remind you to make sure you don't get depressed, that you look safely at technologies, especially to organize your medical information. Make sure all of your legal documents, including all of your insurance cards, everything is all up to order. And then I want every last care partner here to step back and say, I'm doing a great job. Because you are. And you have to believe that. So, Susan, I hope I haven't gone on too long. Apologies if I have, but please come to caregiveraction.org and you can find some very free and hopefully rich resources for you there.
Thank you so much, Lisa. I appreciate you being here. And everybody who's watching, if you have any questions for Lisa, feel free to type them into the Q&A, or you might be able to type them into the chat. I'm not exactly sure. As we said, this is our first webinar setting with Zoom, so we're kind of learning the ropes with that. But again, thank you, Lisa, and I hope that everybody here will look into the Caregiver Action Network and look at the resources. It's really rich. And now I'd like to move over to Deborah North for a moment and have Deborah introduce herself and tell us a little bit about your journey. And then after that, we'll have John and Kathy do that, and then we'll go into more of a discussion with the whole panel. Thanks, Deborah.
Thank you, Susan. And Lisa, I want to say thank you for sharing. My husband has been my caregiver off and on for the last 16 years. So this will be a great resource for him. I'm Deborah North, everybody. Glad to be here. Thank you for inviting me, Susan. I've known Susan for a number of years as we've volunteered for the American Heart Association. Long story short, because my story is super convoluted and I could go on for hours and days about my story. I was born with a congenital heart defect, mitral regurgitation, and whoops, that was my pen. I survived a heart attack and stroke at birth. And I was told when I was younger that I would need my valve replaced, not until I was probably 60. But I was 30 years old when I started having symptoms of heart valve failure, and one thing led to another. We repaired my valve, and then I had got 10 years out of that, which was pretty awesome. But that repair started to decline, and I had a replacement with a tissue valve in 2016. Unfortunately, that valve did not really take, and it started to fail right away. So I had to have my valve replaced again about 17 months later with a mechanical heart valve. And talking about naming your valves, when I had a tissue valve, I named her Edie because it was an Edwards Life Sciences valve. And then I named my mechanical valve Judy for St. Jude Medical. But when St. Jude was bought out by Abbott Technologies, she took on a new name. It was, or it is Judy St. Abbott. So she sounds like a soap opera villain. And I have to admit, she's acting kind of villainous right now because I'm about to have my 4th heart valve surgery in 1 month. So 1 month from tomorrow, actually. Let me go back one step. Last year around this time, I was having issues with my valve. My cardiologist believed that it was a blood clot that was sitting on the valve. I met with the surgeon who determined that we need to move forward with surgery. My valve was sticking off and on. One of the leaflets just was not operating correctly. And I got all the way into the operating room, and the surgeon did one final test, determined that my valve was working just fine, and we canceled surgery. And I was sewn back up, thrown into the ICU overnight, and then on the telemetry floor for another 8 to 9 days as we bridged back to Coumadin and adjusted my INR because we thought it was a blood clot issue. But now the understanding is it's pannus growth or scar tissue that is causing my issue because my valve is sticking again. And I just found this out not even a month ago. So this has happened really, really quickly. And I'm still trying to catch up mentally and emotionally with this latest adventure. But I can't say that, I'm looking forward to having surgery, but I know it needs to be done. And so I will have the full heart valve buffet of different valve types. I believe this time we're going to go with an onyx valve because my surgeon says that one tends to resist pannus growth. So we're going to try that. Hopefully this one is the final last one I will ever need to have, but it's been quite a journey the last 16 years, certainly. So, and that's pretty much it. That's as basic and brief as I can get about my valve story.
Oh, Deborah, thank you so much for sharing that. And I'm really glad that you've joined the My Valve, My Voice community too, because we really want to support you as you're getting ready for your surgery in March, and think of you and send prayers and good thoughts that day and afterwards while you're healing. And I thank you so much for being willing to give your time when you're really very immediately facing and in the middle of a new part of your journey. Sorry, I'm going to get a little drink of water. And also, just to throw this out here, because we're practicing with polls, I don't know if everybody can see, but we put in a poll of how many valve replacements have you had? It's kind of one of those questions you get like at a family reunion or class reunion, and whoever comes the farthest gets a little prize. And kind of wondering if Deborah's going to get the prize today, but
hooray!
Yippee! So feel free, everybody, to click on that poll and answer that. And then next, we're going to hear from John and Kathy, and you guys can decide amongst yourselves who wants to go first, but I'd love to hear from both of you. So great to have you both here too, and it's a gift to have gotten to know you.
Yep. Thanks for having us, Susan, and Lisa. Once again, thank you for your information, because that's so important, And Deborah, we wish you well, and wow, what a story! Wow, what a story! My name's John Wayne Sapp. Yes, my parents were fans of the. You don't get named John Wayne if your parents aren't fan. I'm 61 years old. This is my wife, my beautiful wife, Kathy, and she's my care partner, caregiver, everything else. I'll make mine pretty brief. I am a registered nurse and have been for 30 years. So giving care over to someone else, that was a struggle for me. So what Lisa said about, you you have to let someone care for you, and then in return, you know, of course, it was my nature to keep an eye on her as she was keeping an eye on me, if that makes any sense at all. To make my story pretty short, like I said, about 12, 14 years ago, my primary care picked up on a little murmur and said, hey, let's start you on some echoes just to keep up with it, and just to keep an eye on it. So like every couple of years, I had an echo, and I started out with mild, and then as the years progressed, I went to moderate, and then May of 2021, I went for just a routine echo. It was actually 3 days after my wife had had some hernia surgery, so I was caring for her, and then I said, honey, I'm just going to go get my echo. It won't be anything. It, you know, never is. Here in Gainesville, Florida, I work at UF Health, which is attached to University of Florida. Great hospital. Of course, I work there, but it's still a great hospital. We have a thing called My Chart, where you can actually go into your chart and see what results are and everything like that. So that was on a Friday. I had my echo. Saturday, I came home. I went in my computer real quick I said, I'll just look and see if my results were there, and they were. And it showed that my aortic stenosis had progressed to severe. And so immediately that was like, you know, the old proverbial kick in the chest. And I'm like, wow, what does this mean?
So, you know, with him being a nurse, part of it was a twofold issue here. He knew what it meant. I had no idea what it meant. So Lisa, going back to what you said, that was our first experience of, oh, you have aortic stenosis. Okay. I'm not understanding the potential severity and what the end results to that could be. And like he said, it was literally 3 days after I had major surgery, and literally while I was still in recovery, 2 weeks later was our first appointment at the cardiologist.
Right.
And we were told he needed his valve replaced.
So ironically enough, my daughter, as Lisa talked about spreading, you know, letting other members of the family help you, my daughter works for my cardiologist. And actually, so I called her and I said, her name's Tara. I said, Tara, you know, I have this diagnosis of severe aortic stenosis. I need to see one of your doctors. She said, well, you need to see Dr. Kerensky. You know, he's great. So within like 3 days, I had an appointment and went to see Dr. Kerensky, the cardiologist, and they sent me for another echo just to verify. And so we went through the processes, and he said, I think you need a valve replacement. I'm going to refer you to Dr. Arnatakis, which is our, you know, he's a friend of mine. He's at the hospital. You'll be familiar with him. And he's, you know, he's very, very good. So
the craziest part here was, so once again, as a care partner, no knowledge, I literally have 2 binders sitting here, and that is so important. I started timelines, I started gathering information, I started writing down questions, anything that I could do. Crazy enough, all of a sudden it wasn't about him. It was me trying to make myself feel more comfortable about what my husband was fixing to go through. And it was just a deluge of, you know, appointments, and then, you know, getting a cath done, and, you know, x-rays, and another cath. And it was a crazy ride from May 14th until September 2nd, when he got his valve replaced, with a COVID hiccup in the middle, a delay, which was,
we all know about that.
so nerve-wracking, So,
But so to fast forward, I met with Dr. Arnatakis, and he kind of leaned towards me having open heart surgery. Kind of said, well, you know, we don't have a lot of research. You're 61 years old. You're fairly young. You're fairly healthy.
asymptomatic.
Asymptomatic. You know, every now and again I would get up and be a little dizzy and everything, but really I just attributed that to me getting older. What a terrible word, older.
No.
Anyway, he was leaning me towards that. So we left the doctor's appointment and I came home and of course I'm a registered nurse in the OR, not the cardiovascular OR, but I do trauma, transplants, all the other stuff. So naturally, I was a victim of knowing too much. So I knew everything, you know, from start to finish, all the anesthesia ins and outs, you know, procedural ins and outs and everything. And for some reason, I just didn't have peace with the open heart part. I'm 3 years from retirement, and I really didn't have peace. Well, that's where this lady right down there, if I can point to her, Susan, came in. I started doing research and found my valve, my voice. And I came home and told Kathy, and I'll be honest with everyone out there, there's a range of emotions, man. You go through it, and I'm sure Deborah can speak to that. I mean, every day is a new day, and you know, there's way up days and there's way down days, and you get angry, you get sad. We both cried, everything like. But anyway, when I found my valve, my voice, there's a course on there about being an advocate for care.
That was great.
And it was a great course, and I went through it and I was like, wow, I really do have a voice. So I called Dr. Arnatakis and I said, I need to see you one more time. I need to talk to you one more time because I'm just not at peace with the open heart thing. And
well, and seriously, when we, and Deborah, I can only imagine, there was a point that John looked at me and said, I can't see myself on the other side of this. And I was like, no, you know, you'll be fine. I'm your biggest cheerleader. And literally what he was saying was he couldn't see himself surviving on the other side of whatever may be happening to him. And so Lisa, as a caregiver, I then had to figure out how to maneuver that and be the right kind of cheerleader, not the woohoo, you're going to be okay, but all right, this is going to be tough. And Lisa, please speak.
I'm just chomping at the bit here because one of the things that you are talking about is so important for everybody to keep in mind. So everybody should just stop right now, and I want you to picture some of those super wild roller coasters at the amusement parks where there are two different tracks.
yes.
So one track is going up, the other track's coming down, everybody's going upside down. That's what John and Kathy are describing. Because your care partner and the patient are not always on the same track. They're both going through different ups and downs. And they're at different places along the track. Those cars don't always end at exactly the same time.
Right.
And so often, the medical professionals turn to that family caregiver, and the expectation is that you are that cheerleader. Okay? How many times do we see people coming into the rooms going, oh my gosh, you're going to be great, everything's going to be fine. And it's tone deaf. So we have to find vocabulary. We have to find a way so that John can say this to Kathy, and Kathy doesn't get pushed onto being in the exact same car on the exact same track of that roller coaster. But respecting that your loved one might be feeling great and you are just feeling like crap, waiting for the next shoe to drop.
Yep.
So
And
anyway, back to your story.
Like Deborah said, you know, she, you know, um, she really, really, really took whole care of me, even with the nursing part and everything else. There was parts there I didn't even know myself that needed taken care of, and she realized it. But she's an accountant, I'm a nurse, so there we go. There's where all the binders came from and
All the
all the records.
organization, yeah.
Anyway, so I went back to Dr. Arnatakis and I said, this TAVR thing, I've been on this, my valve, my voice, and I took this course, and I really, can we explore that? And he goes, yeah, sure. He goes, man, you're a nurse, I respect you. I respect your voice. I respect your, and I'll take it to the multidisciplinary team and we'll discuss it, and I'll call you tomorrow. Well, he called me the next day. Well, he was in surgery. His practitioner called me and said, Dr. Arnatakis said, you can have whichever one, open or TAVR. It's your choice. And oh my gosh, just it's your choice. That that was freedom for me immediately. You can choose, and of course he gives me all there's not a lot of research about TAVRs lasting a long time, but there's more research coming out. You can be part of that research. You can, and so I was so excited, and all of that came from, my care partner going, hun, whatever it is you want to do. So I got delayed one day. I went in, I had a cath. My RCA was 80% stenosed. And so Dr. Korinsky, my cardiologist, wanted to get that out of the way before I had a TAVR. So I had that done. Then I got delayed one day for COVID, but my surgeon was, might I say, bullish, and he made it happen. And I spent one night in the ICU. It was
32 hours. It was the
32
craziest experience.
And-
Door to door, 32 hours.
And it was great. And the thing of it is, one of the
And I had
anesthesiologists,
snacks, Lisa.
snacks. One of the anesthesiologists I worked with for years in the OR, his son was my nurse in the OR. So there,
Family.
the family grows, and I'm sure, like I said, Deborah, you probably know some of your, you get to know them, and
Yeah.
and one of the things that Lisa was saying about when those techs come in to check your vitals or whatever, not only did we use that as a moment, but man, we because I know what it feels like, for someone to say thank you so much for taking care of me.
Yeah, I just, through this and even piggybacking on another thing that Lisa said, not too long after he had his TAVR, we were blessed to go on a camping trip with some friends, but we took what was it again?
An AED.
We took an AED with us.
We took an AED, I'm a nurse,
Just in case.
just in case. We
knew where the hospital
We knew where the
was.
hospital was up in North Carolina, where
just
we were
different.
camping, and so some of that stuff is so vital, and stuff you just never think about on a day-to-day basis.
And y'all are now our family, so
Yeah.
it's good meeting you finally too, Deborah. Yeah.
Tell them about some of your.
Well, thank you guys so much. Gosh, it's flying by. It's 2:45 already. Well, in Mountain Time, so it's 4:45 on the East Coast. So we do have to end in 10 minutes. I wanted to ask some questions about, well, one, does everybody see the survey I put up about have you joined the My Valve, My Voice community? Does everybody see that? So if you guys could answer that, and how many of you know about that we have an app? I mean, I know our panelists do because everybody's joined, but those of you who are watching, if you could even give a message in the chat and say if you know about the app or if you've joined. We'd love to hear that. Also want to tell you a little bit more, like this has been so wonderful. And I would love to see us do some meetings like this rather than a webinar, so that everybody who's here can participate and we can see each other's faces and talk to each other. So I apologize that didn't work out. We were trying out the new webinar and we weren't sure how many people would be here today. So thank you guys for coming along with us while we're learning about all of this too, and creating community. And Kathy, did you have a chance to talk about the Care Partner group by itself? I've got so many things running on in my mind. I know we talked about it before, but I don't know if we talked about it during the actual webinar. Did we?
We did not.
Okay, could you share a little bit about that and invite people to?
Sure.
Okay.
Yeah, shameless plug here. Susan and I became very close very quickly. Again, just an amazing platform, an amazing person. And me as a care partner, we knew that there needed to be a safe space. And Lisa and I had talked about this. So it's one thing to be on a Facebook group where there's 800 of you bantering back and forth, but it's another thing to have a safe space where where the patient isn't in there. It is just care partners. And so in my voice under groups, there is a care partner group, and it's a private group. And it doesn't matter, aunts, uncles, moms, dads, daughters, brothers, sisters, whoever is your care partner, direct them to that. We joke right now, we're small but mighty. And we have to be able to have a safe space to share and even get some advice sometimes. So join us. We'd love for you to be there with us.
I was so excited to hear about this. I think it is just a phenomenal opportunity. And I just really want to add my voice to Kathy's to say that you should all join this. And John and Deborah, maybe you should listen to this part. But sometimes your loved one who's the patient isn't so lovable. And that's okay. Hello, that's okay. That's normal. That's natural. It's all part of the process. But you deserve that place to receive that support from others who get it. So join that group. Go chat with Kathy.
I had to take a second to unmute myself.
And no question is out of bounds for anybody, and because if it's in your head, it's been in somebody else's head, care partner, patient, would-be patient. If you think of it, reach out. There's an answer.
That's so true, John. Thank you. And we really are trying to build the community to create a safe spot for everyone. And we just encourage everybody who's here, if you're not involved or if you haven't joined yet, or if you haven't downloaded the app on your phone, would you guys, John and Kathy and Deb, would you guys say that it's much easier to use on the phone? I personally think that. I was using it when we first came out over a year ago. It's been a slow, steady process. We didn't have this app. And now that we have the app, it's so easy. And I think that's why some people do Facebook, is because they have an app on their phone and they can go back and forth and it's easy. Well, now this is just as easy as Facebook. And yet, as everybody has said, it's completely private. And I don't know about you guys. I don't want to badmouth anybody, but or any organization, but I'm kind of over Facebook. I used to be really big into social media, and the whole pandemic thing has gotten me to feeling much more private. I'm not wanting to be out there on social media so much. And this group is so private and great. And we can also, like we're all doing, build relationships and get to know each other and support each other, which is the whole part of it, what's important about it all. I guess I didn't really tell anybody most of you probably know my story. I had Hodgkin lymphoma when I was 17 and recovered from that and went 30 years before I discovered a thing called late effects from cancer treatment, radiation primarily, but I discovered I had heart valve disease, was completely shocked, like John said, that kick in the chest or kick in the gut where you aren't expecting it at all, and no one was following me. So I never heard that I had mild or anything. I just went to the cardiologist one day after my doctor found a murmur, and they said, you need heart valve replacement within the next 6 months. And I was like, what? Wrapping my head around that. It was a shock. And I had TAVR almost 7.5 years ago, back when kind of nobody was having TAVR. I just saw my cardiologist, who told me that I'm the oldest patient. Well, no, I've had, not the oldest, I've had my TAVR longer than any other patient in Colorado who's still with us, because most people who started were, very elderly and wouldn't have lived necessarily 7 more years anyway, but I had it really early on. So anyway, we are getting close. We've got 3 minutes left before we need to go. I'm going to check the Q&A if anybody had, no, I don't see any questions. If anybody is here and you've had trouble asking a question in the Q&A, would you send a chat to let us know? Also, this is being recorded, so everybody will get a link. You can share it with people. We'll try to get more events like this going on through the community. And I have a couple little things that I need to say about Heart Valve Disease Awareness Day. We are part of a whole line of activities happening this today. And so right after this, we're going to end at 55 after the hour. At the top of the next hour, as part of the Valve Disease Day virtual conference, there will be a discussion between Shannon Goldrick of Cardiovisual and Dr. Sean Ali of Novant Health, discussing the basics of valve disease. And you can go to www.valvediseaseday.org/virtual conference to find that and listen in. Again, thank you so much, everybody, for being here. And again, it's just a joy to me to get to know everybody. I mean, the best thing of what I'm doing is, one, it's meaningful to take something that you've struggled with, that's been really hard. I think all of the panelists can agree with that, and turn it into something meaningful and beautiful. Oh yes, John, I'll put them on upside down like you did earlier. But and to be able to laugh together with people who get it, whether you're a care partner, caregiver, or a patient, and to know, like, sometimes you can't joke about something if it's if it's serious, or people who know you think they can't joke about it. But when you've all been through it together, that's the only way we can get through this, right, Deb?
I know humor has been really important to me going through this, because I tell people, if I wasn't making jokes about this, I'd be in a corner crying, so I have to keep it lighthearted, for my husband too. So yeah, for sure.
And I do both.
Yeah. Laugh and cry.
And actually, I found when I'm having the worst time, when I can reach out and talk to somebody else who's going through it, it helps me a lot. Okay, it's 55 after. John, I see you again. Oh, should we all put our sunglasses on to say goodbye to everybody? Lisa, you can do your virtual sunglasses. Everybody, thank you so much for being here. Send me emails, questions, suggestions if you have ideas about things that you'd like to do to build the community. And again, thank you so much, and best to everybody on your heart valve journey. John, did you want to say anything? Or
I was just saying my valve's name is Piglet.
oh, that's lovely. I'm one of those people that I'm like, people name their valves. So I should probably come up with one. Something about being old, I guess. John Lewis, do you have anything else to say? Then we need to sign off. Oh, you're muted, John.
Thank everyone for joining, and hope you had some valuable information, and we look forward to sharing more very soon. Please come to our website, check out our resources, check out our app, and if you've got any questions, certainly Susan and I are here to help, as are the patients like John and Kathy in our community. So thank you very much.
Thanks, everybody. Happy Valve
Thank
Disease
you.
Day. Bye.
Bye.
Toot toot.